Welcome to the deep dive. If you've ever looked at a huge pile of information, maybe for an exam, or just trying to learn something new, and thought, how am I ever going to master this? Well, then this deep dive is definitely for you.
That's right. Today, we're taking a look at a resource that tackles a really big subject, physiology, but does it with, well, a laser focus.
Yeah, our source is a book called 100 Short Revision Notes for Physiology of MRCS Part A Exam by Dr. Atef Ahmed.
Mm-hmm.
And look, our mission here isn't just to review a book. It's more about unpacking the whole idea behind something like this.
Right.
What does boiling down a huge subject like physiology into just 100 short notes actually tell us about, say, effective learning or efficient revision, especially when the stakes are high?
Exactly. How do you really nail that foundational knowledge? So let's dig into what makes this approach potentially so useful, particularly for someone facing a tough exam like the MRCS Part A.
Okay, so first off, what is this resource, fundamentally?
Well, like the title says, it's presented as a book, and it contains exactly 100 short revision notes.
Yeah.
And they're specifically curated for the physiology part of the MRCS Part A exam.
Okay, and maybe just for a bit of context, the MRCS, that's the membership of the Royal College of Surgeons exam. It's a really critical step for doctors who want to go into surgical training in places like the UK.
Uh-huh.
And Part A, that tests the basic sciences. Physiology is, well, it's non-negotiable, right? You have to understand how the body works normally before you start intervening.
Absolutely. You can't fix what you don't understand. So
Yeah.
the audience is very specific. It's doctors, medical professionals who are aiming for that surgical career.
Got it. So the subject is physiology, but as you said, with a focus.
Yeah, it's not just, textbook physiology for its own sake. It's the key physiological concepts that are directly relevant when you're thinking about surgical practice.
Right. Okay, so 100 notes, I mean, that still sounds incredibly tight. For physiology, human physiology is vast. What kind of stuff can actually fit into just 100 points?
Yeah, that's the core idea, isn't it? How do you distill it? The source describes the content as concise, yes, but also comprehensive within its specific scope.
Okay.
These aren't just random notes. They're meant to be expertly curated, distilling those critical principles, the processes, down to their absolute essence for this purpose.
So it's not trying to teach physiology from square one. It's more like you've already learned it, maybe from a big textbook, and this helps you lock in the most important bits for the exam and for practice.
Exactly. Think of it like the greatest hits album or maybe the essential toolkit for physiology aimed squarely at a surgeon in training.
Okay.
The book apparently covers key areas, cardiovascular, respiratory, endocrine, neurological, musculoskeletal physiology, the big systems.
Plus the real fundamental processes too, right? Like acid-base balance, homeostasis, how the body keeps stable metabolism, stuff that's always relevant during surgery and patient recovery.
Right, those cross-cutting themes. It's all about understanding how the body's core systems function, react, adapt, sometimes fail, but always viewed through that lens of what's relevant for surgical intervention and managing patients.
Okay, so that brings us to the philosophy. Why 100 notes? Why this super concise format? It feels a bit counterintuitive compared to, those massive physiology textbooks we all remember.
Well, what's interesting is that the source suggests the brevity is the strategy. It's designed specifically for efficient revision. And the idea is it actually helps achieve a deeper understanding because you're forced to focus. It's a deliberate distillation.
Okay, so it's not a replacement for learning it the first time around.
No, definitely not. It's
Yeah.
positioned as a tool to complement and reinforce what you already know or should know. It helps you solidify it, retrieve it under pressure.
Right, like flashcards, but maybe with a bit more context, focusing you on the most pertinent concepts.
Precisely. It provides that highly filtered view. And the emphasis, according to the description, is all on accuracy, clarity, and direct relevance to that MRCS Part A exam. No fluff. Just the essentials for that specific goal.
Okay, let's talk payoff then. If you use a resource like this, what are the supposed benefits? The description makes some pretty big claims.
It does. It suggests it helps sharpen critical thinking, which I suppose makes sense if you're focusing on the core why and how of principles, not just rote memorization.
Yeah, connection the dots.
And it also aims to prepare you better for the clinical application of physiology, which is obviously crucial for surgery. You need to know how these principles play out in a real patient.
Okay, that makes sense. And it also says it helps you spot your weak areas.
Yeah, that seems logical if you hit one of these 100 core notes and it doesn't immediately click, or you feel shaky on it.
You know exactly where you need to go back and do some more work, maybe dive back into that bigger textbook for that specific topic.
Exactly. It signposts the gaps for more tailored revision. And then you get the bigger promises. Unlocking physiological mastery again, for this context equipping you to handle the exam.
Building a foundation for that surgical career.
And ultimately leading to, as the source puts it, focused revision and unwavering confidence.
Okay, wow. Unwavering confidence from 100 notes. That's quite the claim. But here's where I think it gets really interesting for everyone listening, whether you're a doctor studying for exams or not.
Mm-hmm.
What does this whole approach, taking something huge and complex and boiling it down to its absolute essentials, tell us about effective learning in any field?
Well, I think it really highlights the power of focus, doesn't it? We live in an age of just information overload, constant input, access to everything.
So right.
And a resource like this shows the immense value of having something, whether it's a book, a mentor, a method, that can cut through the noise and say, look, out of all this complexity, these are the 100 or 50 or 10 core things you absolutely must grasp to function effectively here.
Right. It's not just for surgeons. It's a principle for dealing with complexity, period.
Yeah. Absolutely. It's about finding those leverage points, the core concepts that, if you truly understand them, suddenly make everything else around them make much more sense. They unlock the rest.
Yeah, like the foundational pillars. Get those right, and the rest of the structure is much easier to build and understand.
Exactly. Think about, I don't know, learning a new language or understanding a historical period or even getting your head around a business strategy. There are always core principles or key events or fundamental rules that provide the essential framework.
And if you grasp those deeply, the details just slot into place much more easily.
Right. And this book, by explicitly giving you those 100 points for physiology in the MRCS context, it basically saves the user the massive effort of trying to figure out what those core principles are by themselves.
So it's leveraging expert curation. Someone has done the hard work of identifying the essentials for you.
Which is a really key point, I think. The challenge often isn't just accessing information, it's organizing it, prioritizing it, making it stick, making it usable.
Yeah.
And this kind of distillation, this boiling down process is how you do that, having it expertly done for you. That's a huge advantage, especially when time is short.
So wrapping up this part of our deep dive, what we've seen is a resource built squarely on that principle of distillation, taking physiology, a vast ocean, and boiling it down to 100 essential drops, specifically for the MRCS Part A.
Yeah, it's an approach rooted in clarity, conciseness, and making sure the knowledge is directly applicable. It's designed not just to help you pass an exam, but to build that functional understanding you need for clinical work later on.
And maybe the biggest takeaway here is about the power of that focused approach. It's a potent reminder that mastering something complex isn't always about knowing absolutely everything. Sometimes it's about deeply understanding the most important things.
Mm-hmm. Which kind of leads to a final thought, maybe something for you, the listener, to chew on.
Yeah.
In whatever complex area you're trying to get your head around right now, maybe it's for your job or a study subject or just a personal interest you're exploring, what are your 100 short notes? What are those absolute core principles, the fundamental ideas that if you truly deeply understood them would make everything else just click into place?